Oh, there we go.
Hi, Thelma.
Hey, buddy, what's up? Hey, my man. How are you? Oh, I'm doing great.
Oh, Brock? Yeah, we were just right here.
Hey, Katie. How are you? Same.
Politicians yakking. We need to hear the you and the you. All right.
Oh, yeah, I heard about
to the van. I talked to him on that. Knock it off.
Right. Exactly.
You're doing the liquids, he goes.
Power! Power!
What's it about? What's it about? What's it about? What's it about?
There's a lot back there now. Jill's back there. What about me? Down there and do whatever. I'm having home and she calls me over and says, hey.
Did you think you were leaving?
I talked to her.
Yeah, I'm just going to be rolling on it right now.
Oh, thank God. Okay.
I don't even know. The first, October 1st. Yeah.
What are the choices? Lots of
Now, look, now I'm not taking my own advice.
I know, because they had us to move. So
What time is it? We should be ready to start by 4. And Well, we can't be that bad. We still got a treat.
Yeah, very cool. Maureen, are you comfortable standing behind me?
Yep.
Okay. They want to hear from workers. Hey, how are you?
You know who you really gotta get? You know who you really gotta get? See this one right here?
That's why I'm bad too. I slept for 2 hours. I didn't even shower. I literally threw on a sweatsuit and was like, all right, I'm coming.
This one right here. She got glasses 10. Trying to get her to speak. She was a charger some ears. It's God with the face here. Got glasses 10 and she just left the airport GI because she was interviewing a ship. Sorry. Trying to get her to
Oh, God. Well, then hopefully after this.
Oh, fresh pizza, man. Thank you. Thank you.
I gotta find Becky real quick. So we're gonna be here.
Right here.
Let's just like try to figure out the spot.
You want to hold this with me?
Sure, I know they're having you speak at some point.
The school teachers paid for it.
You know what?
Don't worry.
He's been the mayor for a long time. He's been 15 years ago.
Did they literally just drop off more pizzas? Yes. Oh my God.
Surprised everybody else had to get here. Three other politicians.
Yeah.
Higgins and all the guys are probably here.
Tim Penny was here.
Oh, really?
Oh, was she? I didn't know.
I forgot to press start. I thought I was recording the entire time and I wasn't.
She was at the edge of the couch.
I had to come back.
Excuse me.
Hey, Matt. How are you? Having fun?
Yeah.
You should be. You should enjoy this every minute of it. It's an experience of a lifetime.
Is this what they're doing now?
Signs are sure.
I think they moved them out of the way for this. These are brutal.
I know.
Hey, Eileen, there's a press conference right now and there's Byron Brown's. I'm sorry. She just wants me to take her when they go interview her. I don't want to do anyone's way.
More picket signs than hand ones anywhere?
What? I don't know.
Whenever we're ready to start,
Can they tone it down a little in the back? Can they tone it down a little in the back?
can we get it quieted down to
I'm not taking until the one.
All right. So, good afternoon, everybody, and thank you for coming. My name is Debbie Hayes, and I'm the Upstate New York Area Director for the Communication Workers of America. As you can kind of tell from my appearance working, today is our 20th day, non-stop, long hours from 9 in the morning until 11, 12. Last night we didn't sleep at all. We were at the bargaining table until about 3:30 when talks broke down, and it became clear that we were not going to get an agreement. We are hearing, and I want to deal with this issue right up front. We're hearing from Mark Sullivan today, now that a strike has started, that they came in last night and thought they put everything on the table that we needed. Well, I'll tell you what, that's bull. We have been bargaining with them since February. Our first staffing proposal got put on the bargaining table February 26th of 2020. You cannot come in the night before a strike starts and make your first serious proposal on staffing. All kinds of data, and then intelligently write a proposal that will deal with their work conditions. We cannot do that. We have made it clear we are ready to go back to the bargaining table. We want to get an agreement, but I am telling you, we will not reach an agreement until we are sure that everything our members need is included in the contract. It doesn't matter to me where that member works, because we have PBS workers that are trying to keep the hospital clean, and they can't because there's not enough of them. We have such a reduction in dietary workers. They actually had to close the cafeteria, and people who are in the hospital can't get a meal while they're on 12-hour shifts. We have nurses on med-surg floors that are caring for 10 patients at a time, and 5 of them are on ventilators. It is unsafe for people to continue working the way they're working. Right. Thank you. And we're willing to work, but throwing a couple of bucks at us at the 11th hour and thinking we can be bought off on our main issue is completely wrong. And it only goes to show you how tone deaf and how out of touch this administration is with what the workers need. So, ready, willing, and able to get back to the bargaining table. We have federal mediators involved, and if the federal mediators call us and say, I need you back, we'll be back there. So that's all I wanted to address right now. We have a number of workers and guests that are here to speak. And what I'm going to do now is turn it over to our first member worker. Oh, is Jackie here? Jackie. I'm going to send it over to our CWA Local 1133.
Thank you, everybody, for coming and supporting us. We appreciate everything. Thank you to the community. I can't tell you the outreach from teachers, teachers, ECMC, other hospitals. Everybody who's reached out, sent food and everything. This community is aware of what's happening. They're aware of the culture that's going on in there, and they're standing beside us because they know that we have always stood beside them. Thank you so much. I'd just like to speak a little to the culture that's going on in the hospital right now, because we've always talked about wages and staffing and everything. But the culture is really pretty tough in there too. There's discrimination suits that have gone on that it took 6 weeks to even do any investigation on. Nurses are not getting lunches. They're not getting breaks. Neither is respiratory. They're made to wait hours and hours and hours to go to the bathroom. And it's just unheard of. There seems to be no reaction from anybody up there. The culture needs to change. They preach on having compassion and dignity, and none of that is being followed. So in addition to staffing and to wages, I would hope that everybody is aware of the culture, and the culture needs to be changed. The employees need to be respected for all they do. They need to be respected for all the loyalty that they've had. And thank you to the community. Thank you to everybody.
Registered nurse at Mercy Hospital for 30 years. I'm here to let the public know that we are out here on the streets right now because Mark Sullivan and the Catholic health system put us here. We're here to fight for safe patient ratios, good wages, benefits so we can retain and recruit new staffing. We're here to let the public know that we have lack of equipment, broken equipment, inability to do our jobs, and we're asking for some accountability at the top. We're done. Thank you.
Hi everybody. My name is White. I've been working at Mercy Hospital for 4.5 years. I've been all over the country. Transport, nurses assistant, and now as neural processing technician. I never thought that this would happen this morning. Made it very difficult to go on strike. It hasn't been we did hope to go on strike. After most of the bargaining and transport health, staff crisis, did this so they can listen to the order
As mayor of the city of Buffalo, I'm here to support our nurses and healthcare workers. Our nurses and healthcare workers are heroes, and they have proved that time and time again during this pandemic. They have stood up for us, and I am here on behalf of the community to stand up for our nurses and healthcare workers. You've heard some of the issues today that our nurses and healthcare workers are fighting for: fair wages, fair market competitive wages, staffing concerns, the nurse-to-patient ratio, which is so important. It's important to the health of our healthcare workers, but it's also important to the health of patients who are in the hospital. I am urging the management to work with our nurses and healthcare workers. I want to thank Debbie Hayes and Jackie and CWA and the work that they're doing representing our nurses. They are doing a great job negotiating, and all they're asking for is fairness. On behalf of CWA, I have had the opportunity to speak with management a number of times. They say that they are committed to working with the nurses. I am hoping and praying that that is true, and that this strike can be ended in the very near future for the benefit of all parties, for the benefit of our nurses, for the benefit of our patients and health care in Buffalo and in Erie County. Thank you all very much.
How much money did he take from Catholic Health?
How much money did did you just make from Catholic?
20? 30,000?
My nurse in the ER. I've been there for about 5 years. I just want to start this by saying that the amount of guilt that we all feel for having to walk out. We feel very, very badly for the write-up of what general that they have to take in our patient. But we just feel like we're forced to have to. We all have the patients. We ran out of cups. We couldn't give medications with no cups. So that we should clean water. Turkey sandwiches are gone. Patients isn't about just medicine. The dietary is not there. Environmental is not there. It's very disappointing that we have to work under conditions. All we want is to provide the best care for our patients. And the whole team has to be there and present and staff in order for that to be done.
No, I just moved on.
You can join me in prayer. Dear God, we pray that you watch over these persons. We pray that you soften the hearts of Mark Sullivan and the management at Catholic Health. We pray that you let justice roll down. We pray that you give strength to this community to stand behind the brave nurses.
We sit at that table for hours, waiting for them to bring us an emergency. Not packaging with these things. We've spent 18 days in a row, countless hours, waiting to resolve this. This does not make us happy to be here. Our happiness is in there taking care of those we are committed to serve. This isn't just a job, this is our passion. And we want to be in there taking care of these people. This is not a vacation for anyone. Yes, we have come together on some of the issues, but some of the issues we are very far apart. One of the most important issues is patient care, which means providing the staff, nurses' aid, nurses, respiratory, x-ray, whatever it takes, EVS, to provide the care to these patients in a safely manner. I work in the ER. I should not have 6 patients. I should not have to decide which one is more critical than the next. Who can I put my attention to and take care of? And hope that when I come out of there, they can feel their life are still okay. All we want to do is provide the best care to those that we serve. For everyone. And it's not just Mercy Hospital. Our counterparts at Kenmore and St. Joe's about the same thing. We are working together. We are one family. 3 hospitals, one family. And we all want the same. We all want patient safety. And that's our main goal.
once through all of this. We've not seen one. Our director of nursing, Sherry McDonald, has not shown her face at our table. We've had up management from departments at the table, no upper level. So we invite Mark Sullivan to come to the table, show your face, so we can tell you our stories and our horrors living inside this building every day. And also, Eddie Bracco, you can surely join him. Thank you.
Good job, Cheryl.
Hi, good afternoon, everyone. Let's give a huge shout out to our workers out here. Let's go some up. My name is Franchelle Parker. I'm the executive director of Open Buffalo. But today, I'm not speaking to you as an ED. I'm speaking to you as a mom. I live right down the street, and as a mom that just recently gave birth, I can't talk about the critical nature of needing to have a nearby, clean, functioning hospital. So I know for a fact that the healthcare workers today do not take it lightly going out on strike, right? Like, this isn't a vacation. I know we are working out here today. So one, thank you for your service. But as a mom, right here in this community, we need a hospital. We need a hospital that's clean, that's safe, and that's functioning. So as a resident in this community, I am encouraging management to come to the table in good faith. Not with charades and talking points, but really, let's close this deal. Let's give all of the necessary requirements in order to reach a fair deal to make sure that our workers can get back to work, doing the work that's so critical to our communities, to moms, to the surrounding community. Open Buffalo stands in solidarity with all of the workers that are out here today. We got your back. So however long it takes,
Thank you.
We got your back.
Sean Ryan. Sean Ryan. Who's that?
How's everyone feeling today? You know what the United States Constitution says? It says we can join together to have collective action. I think I'm feeling some constitutional rights today. Our founding fathers said we should be able to use our voices together to petition governments, but also to come together as workers. And we do that, and what happens when we come together? We get jobs that pay good money. But also when we come together, if we have employers who aren't treating people fairly, if we have employers who don't pay attention to the bottom of the wage scale, if we have hospitals that are dirty, you know what else workers can do that? They can collectively take a step out of their environments. And that's what you're doing today. And we respect what you're doing today, and thank you for what you're doing.
That's the lyric out back.
We all know that walking out is the hardest thing to do. You don't walk out and strike for yourselves. You walk out and strike for the next generation of workers that is coming behind you, and that is the history of the American labor movement. So you folks are taking the hit. You're the front of the pack, and you're making so that the people who work in hospitals behind you, that they have a hospital system that has safe staffing in it. We all work together for safe patient handling. But we also know if we don't work together, it's so easy to go backwards. So I remember just a few months ago, you folks were all heroes. For some reason that doesn't work anymore. But you're still treating the same COVID patients. And it's not just nurses, right? It's a whole hospital together. And when I heard what they pay the environmental services, the frontline janitors coming into the hospital, you know what they get paid? Less than $13 an hour. You got a choice today. You want to work at Tim Hortons for $15, or come to a hospital, put yourself in a dangerous situation for $13 an hour. That makes no sense, and that's why you're not getting good people to come in to the hospital and stay at the hospital. So I'm here today I'm going to be here again, and I'm going to be here again. And I can't tell you how much I appreciate what you're doing. It's for yourselves, it's for your families, but it's also to maintain the middle class in Western New York State, and the nation. So keep it going.
Well, he needs to go somewhere with his rude ass comments.
And I just want to make it really clear. We did not walk off our job. No one here wanted to. We were here at 5 o'clock this morning. Our badges were getting locked out at 6 a.m. And we went up to every floor to make sure every patient was taken care of. The handoffs and the reports were given. The nurses were being covered by managers, and everything was okay. And every single worker was able to walk out. I saw tears from managers as we were leaving the building. I saw workers with tears in their eyes that they have been put through this and cannot be in the situations that they did. It is horrific for us. It is horrible. We don't want to do this. We don't want to do this. All we want to do is get back in that hospital. So I just want you to know that this morning when we were walking out, it was awful. There were tears in our eyes and tears in management's eyes. No one wants this. So please, we know that we can contract as soon as possible. Thank you. Thank you.
Yeah, James?
Hi, my name's James Stretta. I'm a barista at Starbucks. Starbucks Workers in Buffalo recently formed their organizing committee and launched an organizing campaign, Starbucks Workers United. And I'm here today speaking on behalf of them in solidarity with all of the nurses part of CWA 1133. I feel two things today. I feel sad. I feel sad for all of the nurses. They've all spoke how sad they are. They don't want to be doing this. Nobody wants to be doing this. I feel sad that I have to be here. I feel sad that we don't value care in this country. Why don't we value care in this country? If the people who ran this organization valued care, we wouldn't be here right now, and there would have been a fair contract that would have been bargained long ago. That's right. Nurses, everybody who works in a hospital, they care. Why don't we value that? I've had to be in hospital. Everybody's had to be in a hospital at some point. We all need care, and nurses do so much of that important work. We need to value it. They need to come to the bargaining table and bargain a fair contract for everybody who's here. I'm not just sad though, I'm proud because I am a proud member of the labor movement that makes it possible for us to get something like a fair contract.
That's right.
I'm proud to be here as a barista with Starbucks to be able to stand in solidarity with all of these awesome workers, and we're going to be here until we get that contract.
Good afternoon, everyone. So, we said weeks ago, they wanted a fight, they got one. And we will make sure we win this fight. Because we are right on the issue. We are fighting for our patients. You're all fighting for your communities. You're fighting not only for yourself as healthcare workers, but for workers, healthcare workers that are coming behind you. Those who are not yet in the field. We are not asking for anything that is crazy. We're asking to be respected. To give the healthcare workers in this facility and in every facility here in Western New York the tools they need to get the job done. On behalf of the Western New York Area Labor Federation, we stand with you today. We will be here tomorrow and for however long it takes until we get the contract that we deserve, not only here at Mercy, but at St. Joe's and every other hospital that we're fighting for. Thank you. Thank you.
I'm here to say that this is systemic ableism. This is disability discrimination. To have our workers that work for disabled people to be treated with such disgust. It is their right. It is their right to have health care, the disability community to have health care. And we are removing that due to the economic catastrophe that is happening in workers' lives right here and right now. I ask that the contract be mandated right now from Mark Sullivan to have change and to be pushed even further to have more healthcare ability for all workers.
Okay, Mark Sullivan, first off, you said federal mediators involved. You're willing to come back to the bargaining table when they call.
That is absolutely correct.
But we're also hearing these reports, no negotiations during the weekend, not until Monday. Is that correct, or what are you willing to come back?
We originally believed that there would go a couple of days to cool down, and that is very common when you have this level of intensity. And it was our offer, we made an offer that the minute you want us back at the table, we'll be there. I pushed the offer there to the hospital pharmacy representatives before we left. So make no mistake about it. If the federal mediator calls us back to negotiations and says this is when you need to be there, we'll be there.
One more thing with Mark Sullivan, because you're responding to him. He said, quote, what he's saying. He said on staff an hour ago that they are willing to bring in 150 to 230 more staff, spend over $100 million to do that, to address your staffing concerns. What do you say?
What I say to them is they propose targets, and we agreed to reach targets, to reach certain goals in 2016. And you know what happened? They followed our language for about a year and a half, and then things slowly declined once they figured, all right, we met our targets, and now we're going to do what we want. It is unacceptable to walk in after 2 months of on and off negotiations at the 11th hour and throw something in front of us and expect that it's going to get the job done. Targets are not going to work. We need ratio.
Hey!
They've seen the replacement workers being blocked. Now, I know people aren't going to like this, but I'm going to ask you. What would you say to the public who says the replacement workers are trying to take care of the patients while you're not in there? And you can't have it both ways. You want patients.
All right. There's nobody that can go in that hospital and do the work our members do. We have doctors who are refusing to do surgery, who are refusing to deliver babies, who will not admit their patients because they know that scam workers won't do the job that our members do. The millions of dollars that they're willing to spend to bring these workers in and invest it in their employees who might not be. legislation. It is fair to say that the subsidies that came from the government did not fully replace what they lost providing the care. But I want to tell you, these staffing issues and the problems that our members are having in those facilities started before COVID. We have been talking about staffing issues for years. We had 40 members come to the bargaining table on August 3rd when we made one of our staffing proposals. And we literally had workers sitting in the room sobbing as they were trying to communicate to their bosses why it was impossible for them to continue to work. They were in the environment that they were expected to do it. This is not anything that we take lightly. But the bottom line is, and I learned this when I was in studying to be a nurse. Thank you. One of our primary responsibilities, and it's not nurses, it's X-ray and respiratory, and our ITAs and our nurses aides and dietary, EBS. We are patient advocates first and foremost. We are the ones that are responsible when things are not being done right to stand up and say, this must stop. And you know what our members are being told when they complain about this? Come down to HR. Come on down to HR because you're insubordinate. You shouldn't tell us that we're irresponsible because we can't get staffing to you when you need it. So being a patient advocate, number one, but then we have the right and the responsibility to stand up for ourselves. If we can't stand up for ourselves and demand what we deserve in our workplaces, then who else is going to do it for us? That's why every one of these members is out here. Can't do it anymore. I've tried. I've come to work. I've done everything that you've asked of me, and I can't do it anymore. So here we are.
Deb, who should take the initiative to restart talks? It sounds like each side is kind of waiting for the other one to make the first move. How will the talks get restarted?
So I am regularly speaking with folks in CWA. We are trying to make it clear to Catholic Health that we will be there and we will bargain when they're ready to bargain. But to Maureen's point, do not expect us to come in on a Saturday or a Sunday or a Monday, whatever day, and sit there for 10 hours and wait for you to figure out what you're going to do and then put something on the bargaining table. We'll be there, but if we're there, they better be ready. They better come prepared to reach an agreement. And if they come prepared to reach an agreement, we're going to be there to get the job done.
One last question. We know that there have been other strikes around the country, Tenet, 7 months, others 2 days, 1 day. Bottom line, and I know you're going to say as long as it takes, but how long are you prepared to be out in this strike?
How long does it take? Yeah, I mean, we are prepared to do this as long as it takes. And we are hearing what Mark Sullivan is saying. He wants to get back to the bargaining table and he wants to get a deal. And if that's true, then let's see it. Action speaks louder than words. It's very easy to kind of point the finger at us and blame us and make us out to be the bad guys. The bottom line is get your act together, get a proposal together that makes sense, get to the bargaining table and we'll get it done.
Get some rest. Thank you.
Thank you.
Said man the
Come right in. Sounds good. Hey. We got like 4 people that come here. Oh, down, Evan, and then come back. Really? Coming back. I don't know where they're going. They should go all the way around. You need to come back at the corner.
Pick it, Poopy.
Normally you do like 150 by now.
They have no porta potties.
Tell her to call me. Oh, my mom did. She called the news, and then they called her. She's like,
Hey.
I have no idea.
Hey.
Hi. How are you?
Good, how are you?
Good. I gotta control a little bit. Aww. How far now?
4 months.
Aww.
Live streaming still.
Yeah.
Yeah.
When I didn't realize that there was a press conference. That's why I'm like, when you're like, that's why like I called you and I'm like, are you at the press conference? Like, hey?
Hey, Bob. Good. Good.
You
How
know
are
what the petition is online?
Like the link?
Yeah.
What is it? Buffalo Safe Staffing. SafeStaffingBuffalo.org.
SafeStaffingBuffalo.org.
Yep.
Yeah, they're done. They gotta pay us 12 hours anyways.
Yeah.
Okay, so do you guys want us to walk our way?
Are you gonna be here tomorrow morning?
Yes, honestly, I didn't know if you knew about it, so I always wanted to. I didn't know if you knew like when and where. I knew you knew, but like you were getting it, but I didn't know if you knew where and when it was. Maybe that would have surprised you.
Where and when what was?
Tomorrow morning.
Like I'm bringing breakfast.
Yeah, breakfast.
Okay.
Yeah, breakfast, yes. 6 a.m.? What time?
Yeah, I'll be here 6.
All right, 6. That's what I meant.
Okay.
Yeah.
It's a lot of pizza.
It is.
I'm gonna go down there, cover
Okay.
their chanting.
All
Are you
right.
gonna be here for a while?
Yeah.
All right.
I'll be walking, but yeah.
Fine with me.
Hey, how are ya? Hey, Joe. How you doing? Good to see you. Yeah.
our foul. I have a task to do the whole thing.
Everywhere we go, people want to know. Hey, Brian.
Stand up, fight back! Stand up, fight back! When union members are under attack, what do we do? Stand up, fight back! Hey, people!
Oh, yes.
What's this about?
Ask her if she wants a donut.
Oh, so cute. Hi, Judy.
What's this about?
She's going very quick. Real, come here.
Tell me what you want. You really want. Tell me what you need, what you really need. Tell me what you want, what you really want.
Oh, I suppose.
Rise up. Our people rise up. We're fired up. We won't take anymore. One, we are the people. Two, a little bit louder. Three, we want justice for the people.
Is we jumping in the second?